Hi, I'm Dr. Chouraeshkenazi, a licensed psychology resident and clinical neuropsychometrician. Today, I want to share some common red flags that I see during mental health evaluations. These signs are something that might be off, not always a crisis, but something worth paying attention to. So let's jump in. Mood changes. One of the most common signs we often see is a noticeable change in mood. This could mean feeling down, irritable, or emotionally flat for days or weeks at a time. Other times, someone might describe mood swings that feel extreme or unpredictable, like going from energized and restless to exhausted and hopeless within a short period of time. If mood changes start interfering with your work, school, or relationships, that's a red flag. Behavior changes. We also look for shifts in behavior, things like withdrawing from friends and family, changes in your sleeping or eating habits, or even a sudden drop in your performance at work or school. Sometimes people often start engaging in risky behaviors like excessive spending, reckless driving, or even substance use, and it usually doesn't match with how they typically act. These changes don't always feel obvious to the person going through them, but they're obvious to the people that are around them or in their environment. Many people are often surprised that mental health struggles often affect the way they think, right? We see things like difficulty concentrating, memory problems, trouble making decisions, or even feeling mentally foggy at times. So with that said, these signs show up in a lot of conditions like anxiety, depression, ADHD, or even PTSD-like symptoms. Physical symptoms. Mental health doesn't just affect the mind, it also can show up in our bodies as well. Frequent headaches, stomach aches, chronic pain, or even chronic fatigue, unexplained aches. This can all be related to physical symptoms that we even relate into physiological symptoms of stress, anxiety, or even depression. Many clients that I would deal with, they see several doctors only to find that their root cause is psychological. That's why they're usually referred to me for a mental health evaluation. Finally, we listen closely to how people talk about themselves because we often see patterns like feeling hopeless or helpless, constant self-criticism, thoughts like I'm a burden or nothing's going to ever get better. These all can be deeper signs and deeper concerns, including depression or suicidal thoughts. If someone starts expressing this kind of thinking, even subtly, we take it seriously. It's important to know that these warning signs don't just show up during mental health evaluations. They're often present in daily life, and they're noticed by loved ones, coworkers, or even teachers firsthand. However, if someone is actively experiencing these issues, especially at a high level, what we call high-level pathology or over-pathology, it can absolutely impact the results of the evaluation as well. For example, severe mood or cognitive symptoms can interfere with focus, memory, or how someone responds to an assessment question. That's why context matters. An evaluation always considers how someone is functioning at the time of testing. There have been scenarios when I have sent the patient home due to the fact that they didn't receive sufficient sleep the night before their evaluation, or maybe they had been drinking and been out with their friends the night before, or even certain medications that they may have taken the night before that can impact how they test the next day. That's why all these things are factors with mental health evaluations. We want to have clear instructions for them to let them know that we want you to try your best and we want you to be in the best condition as possible. So if you're not receiving adequate sleep, if you're not eating properly, and then you come in to test, we might not have that best foot forward for you, and it might skew the impact of your results based on your performance if you're in that arena where you have not, made sure you had a good night's rest, something to eat, and you're properly ready for this evaluation. Early recognition and support can make a huge difference. If any of these signs sound familiar, something that you're dealing with yourself or someone that you care about, consider reaching out to a mental health professional and seeking a proper evaluation. And if this video has helped clarify things, please like and subscribe and share it with someone you think may need this information. Thanks for watching. Take care of your mental health as well as you with your physical health. And remember, support is always available. See you in the next video.